What is ICSI in assisted reproductive technologies? Imagine being able to help couples who struggle with infertility have a chance at parenthood. That's where advanced techniques like ICSI come into play. If you're curious about how scientists and doctors make this possible, stay tuned. ICSI stands for intracytoplasmic sperm injection. It is a special lab procedure used within assisted reproductive technologies to help fertilize an egg when natural methods might not work well. This technique is often combined with in vitro fertilization, where eggs are taken from the ovaries and fertilized outside the body. In ICSI, a tiny glass needle is used to pick up a single sperm cell. The doctor then carefully injects this sperm directly into the cytoplasm of the egg. This process bypasses many natural barriers that might prevent fertilization, especially when sperm quality or quantity is low. It is particularly helpful for men with very low sperm counts or poor sperm motility, which means the sperm are not moving well enough to reach the egg naturally. The procedure usually takes about 30 minutes per egg and is performed in a specialized laboratory. The fertilized eggs are then monitored for several days to see if they develop into healthy embryos. These embryos can later be transferred into the woman's uterus to try and achieve pregnancy. ICSI can significantly improve the chances of fertilization when traditional in vitro fertilization has failed. It is often used when previous attempts have not worked or when there are known male fertility issues. The cost of ICSI can range from around $5,000 to $10,000, depending on the clinic and location. The procedure itself is generally quick, but the entire process from egg retrieval to embryo transfer can take about 2 to 3 weeks. From a family genetic planning perspective, ICSI raises some important points. Since it involves selecting a single sperm to inject into the egg, there is a small risk of passing on genetic abnormalities linked to male infertility. Some genetic issues, like deletions on the Y chromosome, can be transmitted to male children. That's why genetic counseling and testing are often recommended before using ICSI, especially if there is a family history of genetic disorders. In addition, ICSI is frequently combined with preimplantation genetic testing. This allows doctors to screen embryos for specific genetic conditions before implantation, reducing the risk of passing hereditary diseases. Advances in genetic testing have made this process more accurate and accessible, helping families make informed reproductive choices. Overall, ICSI has opened new doors for many couples who might have thought parenthood was out of reach. It offers hope, but it also requires careful planning, counseling, and understanding of the genetic implications. With the right guidance, families can make choices that align with their health and future goals.